Welcome back. You want the key info on keeping your pets healthy, right? But without wading through tons of medical speak.
Yeah, exactly. And today, we're tackling a topic that probably causes some anxiety for pet owners. Common tumors in dogs and cats.
It definitely can.
And we're really zeroing in on just one aspect today, what these common growths actually look like. We've gone through material that describes their physical appearance.
So the visual signs, the things you might actually see or feel.
Precisely. Think of this as a quick guide to visual recognition, sort of a first alert system.
Right. Our mission here is pretty focused. Pull out the key descriptions of these common tumors from the sources we looked at, just to help you get a baseline understanding of what you might be looking for.
And it's interesting, the sources really highlight the sheer range of appearances. Tumor isn't just one thing visually.
Not a single picture in your head.
No,
Yeah.
not at all. And knowing that variety exists is, well, it's step one in being observant, really.
Okay, let's unpack that. When the sources talk about physical appearance, what are some specifics? What might you actually, see or feel on your dog or cat?
Well, for dogs, the sources point to things like raised bumps on the skin. Sometimes these have color, sometimes they're just skin color.
Little bumps.
Yeah, or you might feel a firmer lump, maybe just beneath the surface
Yeah.
when you're petting them. What's key, the sources stress, is that even things that seem small shouldn't just be ignored.
So like finding a new freckle, but it's raised up? Is that the kind of thing?
That's a pretty good comparison, actually.
Oh, yeah.
Yes. And the sources also talk about lipomas. Those are fatty tumors.
Ah, yes, I've heard of those. Common in older dogs.
Very common, yeah. The material describes them as often feeling soft, kind of movable under the skin.
Soft and movable sounds.
Hmm.
Less scary.
Generally, they're benign, yes. But the sources do mention that if a lipoma gets really large, it could potentially interfere with movement depending on where it is.
Okay, so even soft and movable isn't an automatic don't worry signal, according to the material. Good to know. What about cats? Are the visual cues similar?
There's some overlap, but also differences. The sources mention mammary tumors, especially in female cats that haven't been spayed.
Okay.
These can show up as firm little nodules along their mammary glands, where they produce milk.
Right, firm nodules.
And skin tumors in cats, the sources say, can look quite varied too. Sometimes they're open sores that don't heal. The term used was ulcerated lesions.
Ulcerated, okay, so a sore that just won't go away. That's a visual clue, the sources point out.
Exactly. Or they might just be firmer masses, kind of like some of the dog ones.
Yeah.
The sources also make a point about location.
How so?
Well, growth inside the mouth, for instance, is likely viewed with more immediate concern based on the material than maybe a similar-looking bump on their back. Different implications.
That makes total sense. So the sources aren't saying you can diagnose just by looking.
Oh, absolutely not. They're very clear on that.
It's more about flagging potential issues.
Precisely. The visual appearance is just the first piece of the puzzle. The thing that makes you think, I should get this checked out. A proper diagnosis always needs a vet visit, maybe tests.
Got it. So for you listening, the main takeaway from our deep dive into these sources is that common tumors in dogs and cats don't have just one look.
Not at all. They can be bumps, lumps, soft, firm, raised, flat, colored, skin-toned, all sorts of things in various places.
And being aware of that range, that spectrum of possibilities described in the material is really the first step.
It's about vigilance. Noticing something new or different on your pet. That's the trigger to seek professional advice.
Right. Just being observant. Okay, so final thought here. Considering this variety we've just talked about, small bumps, firm lumps, different locations. If you did notice something unusual on your pet, what are some initial questions you might bring to your vet? Something to think about as a starting point for that conversation.